if your ultimate goal is to stop your quadriceps tear from returning, you have to take a step back to understand that it wasn't bad luck that caused your quadriceps to tear. G'day and welcome back to the channel. So in today's video, I want to show you how to fix a quads tear, but more specifically, this video is particularly for anyone who has been developing recurring quadriceps tears or quadriceps issues, or also someone who is past that initial acute injury stage of a quadriceps tear where your pain, inflammation and swelling has been reduced, and you're now at that point where you want to reclaim some normal functions through the front of that thigh and obviously make sure that it doesn't come back again in the future. Now, the first thing that we need to get to before we can even progress to these exercises is we need to have a conversation about why your quadriceps muscle has torn in the first place. Because ultimately, if we don't get a really strong handle on why your quads became torn in the first place, it's ultimately unrealistic to expect that this may not have the potential to come back again in the future. And based on what I find clinically with my patients, the overwhelming majority of patients who come in with a torn quad have some pre-existing, albeit relatively hidden, low back dysfunction. Now, the reason for this is that the spine plays a very strong role in the function and the day-to-day mechanics of the human body. So if you have any subtle joint stiffness or some muscular dysfunction, even if you have some arthritis or some wear and tear, or even a subtle disc bulge or maybe a stenosis, maybe some increased neural tension coming from the nerves that associate with the muscles at the front of your thigh, then you can set yourself up for dysfunction when you're doing the things that you do day to day. And the other important thing to touch on here when trying to understand the cause of your pain is that it's very easy to feel like that what you were doing at the moment that it hurt or tore, whether that's running, jumping, kicking a ball, sprinting, or doing something else, it's very easy to feel like that was the thing that caused your pain and caused your tissue to injure. And while that's true on one level, when we take a step back and try to understand the bigger picture, we know that there has to be a reason why that specific moment, that specific muscle on that specific leg, at that specific time, there has to be a reason why that happened to you. And then when we keep taking these steps back, we can understand that using your body on its own should never be the ultimate excuse for injury, because we know that use and activity is ultimately normal. It's what our body needs to stay healthy. It's also what our body needs to progress and evolve in terms of more strength, more endurance, better skill acquisition. Doesn't matter what you're doing, the more we use our body, the better it's supposed to get. So if we then use this excuse that using your body was the thing that caused it to injure, we're potentially missing some of the hidden issues that might have been going on behind the scenes that set that tissue up to fail when it did. And as I said before, what I'm finding clinically is that there is a section of your low back, basically at the top of your lumbar spine and potentially the base of your rib cage, that when dysfunctional, starts to create some havoc and a mechanical chain reaction of dysfunction that can set your quadriceps up to become an issue in the first place. The important thing to do here is we can use a foam roller. Again, we want to start basically at that junction between your thoracic spine or the base of your rib cage and the top of that lumbar spine. By placing the roller in that area, all we want to get you to do is to lie down and recline back over the roller. So if you feel comfortable going all the way over, that's fine. If you need to have your hands behind your neck, that's also fine. If you need a bunch of pillows underneath, again, that's fine as well. Once you've found a spot sort of at the middle of your back or towards the lower end, then all I want you to do is just gently rotate your body to the left, then gently roll your body to the right, and just take note of how it feels on that segment. Because one side will likely feel more stiff than the other. And again, as we go through a lot on the channel, even if you found that one quad tore, that doesn't automatically guarantee that that same side of your back is going to be where the dysfunction is. Choose the side that you feel needs the most TLC. And again, we're not rolling, we're just staying here for 30 seconds to a minute until you feel like that tissue starts to give a little bit, maybe it becomes a little bit less tender. Then once you've done that, all you need to do is just roll the ball down a fraction until you feel like you hit the next spot. Compare both sides, stay on the side that feels the most restricted, and keep systematically working your way down your spine, looking for any areas that feel restricted. Now, as a quick hack for that exercise, or a quick tip, it's very rare that things will change from side to side as you go down the segments. So if you find that on one side is very stiff, and then you go down another segment and you feel like that segment is also stiff on the same side, it's very likely that it's going to be all the way up and down that side, and you're not going to have to go between sides to find where that stiffest area is. But by ultimately getting to that underlying low back restriction, that low back stiffness, we can obviously decrease the joint stiffness, we can decrease any related muscular tightness, We can potentially decrease some neural tension that might be coming from that femoral nerve that goes directly down through that quad and pulling a bunch of slack out of that, so that you are then now not taking that into your activities and you're running or sprinting, the same activities that caused you to become injured in the first place. You're now doing that with freer, more mobile, more functionally optimal tissue. So I want to make it really clear off the bat before we get to these other exercises to help you recondition and rework some of the common issues associated with quadriceps tearing. If you're not having a conversation with your lower back, whether you have low back pain or not, then you may fundamentally be missing one of the pillars of why that tissue became torn in the first place. And if your goal is to make sure that you rid yourself of this issue for life, then we need to make sure that you're at the very least self-assessing and self-treating that area and seeing how you feel over time. Because as we start to take away some of those hidden handbrakes, we can start to see that your strength, your flexibility can start to return a little bit faster, and we're taking away those hidden handbrakes, as I said. Now, moving on to these other exercises, there's some valuable insights that we can gain from the assessment techniques in terms of what your low back is doing. Because if your hips are stiff, as well as your quadricep muscles and the tissue around that, then obviously that can create this disharmonious or suboptimal function in your quadriceps area, which can set it up to fail going forwards, but can often be missed once you've injured yourself, because once the pain and the inflammation and the swelling has gone away and you start to regain that normal function, it's really important to go through these exercises / self-assessments without the presence of pain, so that you can see what's actually going on behind the scenes and what's left over once you've recovered from the actual damage itself. Because if you're not trying to find these hidden handbrakes and taking them off, then again, it's unrealistic to expect that this will not have the potential to come back again in the future. So the first exercise that I want to get you to go through with this is an exercise that frees up the front of the hip joint capsule. And obviously one of the main reasons why things get tight is that we spend a lot of time sitting in a 90-degree hip position. So again, that rec fem tissue can become tight. The joint underneath can become tight and stiff as well. So in exercise, it's a fantastic way to decrease some of that restriction, feed a lot more slack into the front of your thigh. So all we want to get you to do is grab a band, and in this case, this is a power band or a jump stretch band. I'll leave a link in the description if you want to pick one up. We want to basically come back as far as you feel comfortable in this high, sort of a kneeling high lunge position. And we're going to basically press back into the band. What this band is doing, by hooking into the back of the joint, it's optimally opening up the front of that thigh, the front of that hip joint, and really addressing any of that hidden underlying capsular stiffness that can be a handbrake to normal function. So again, you've got a few options here. You can oscillate in and out of that range. You can go into different directions instead of going backwards and forwards. Just scour where you feel the front of your hip needs the most attention. So for me, if I sort of twist my body away a little bit, I find a little section that's a little bit more towards the groin that feels a little bit restricted. By gently oscillating backwards and forwards here, we're encouraging that tissue to give and release and improve the mobility of the front of that hip. Now, the other thing that you can do here is you can play around with your foot position. So if you internally rotate your hip and turn your foot out a little bit more while still facing forwards, that will wind up the front of that capsule a little bit more. It'll capture some of the soft tissue a little bit more. And again, repeat the process of just changing the vector or the direction that you're pressing into, just to find where your best tightness is to give you the most impact from this exercise. And again, you can do the same thing by externally rotating your hip. You might find you get a little bit more through the groin, but again, we want to find and remove any of that hidden restriction at the front of the hip to give your quads a chance to function as normally as possible. And I think it goes without saying with these exercises that some of these, particularly the stretches, are best left until you are 100% comfortable that your pain has reduced. We want to make sure that the tear itself is relatively healed and meshed up again before we start tugging on the specific tissue itself. This exercise is a little bit more positive because it's going to be biasing a different tissue. It's going to be biasing the tissue at the front of the hip, that deep hip joint capsule. It's not necessarily a quadricep stretch like the one we're about to get to. So this one and the low back exercise that we just did, maybe two exercises that you can begin to do or just respectfully introduce into your rehab program as your therapist or as your body sees fit. So please make sure that you don't get any pain or discomfort from any of these exercises. There will be some tender spots, there will be some uncomfortable spots, but we can't be reproducing or exacerbating your issues, otherwise this is going to take a lot longer to go away. So the second exercise I think is really well worthwhile doing for anyone who has a quadriceps tear is the couch stretch. Now the reason for this is the couch stretch is by far one of the best soft tissue stretches that I've ever seen. It's an exercise that really winds this rec fem and all the other quadricep muscles up into a position that really allows you to free them up as good as anything that I've ever seen. Obviously, as I said before, please don't do this if there's any hint of pain or injury. Make sure that you're free of that and you're able to tolerate this. You might need to start a little bit more horizontal to begin with and just slowly come up to wherever you feel comfortable and stay there. But eventually we want to get you to the point where you feel like you can be up nice and tall and feeling comfortable. If you can't do that and you're getting consistent quadriceps tears, this may be one of the main reasons why that tissue isn't tolerating the things that you're doing, because it's over-tensioned, it's tight, there's too much resistance in the system. So even if it takes you a little bit of time to get to this upright point, please make sure that you keep chipping away at it, because you'll find a hell of a lot of quadriceps muscle tightness and even some hip flexor tightness in this position. Ultimately, making this very specific to you and allowing you to undo as much of this tightness as you can to set this tissue up for success going forwards. The next thing that's really fantastic to do is to take a ball, or maybe even a foam roller as well, and start scouring around those quadricep muscles for anything that feels restricted, any soft tissue restrictions. Try and encourage some of the surrounding musculature to relax as well. Now again, it goes without saying that you don't need to be digging a ball into the exact injured area. Maybe once you feel like everything's fantastic down the track, it might be a good idea just to try and normalize some of that scar tissue. But the important thing is to go hunting around that. Anything that was tight before the injury, there's definitely going to be a bunch of subsequent tightness post-injury as your body's sort of been trying to compensate for what's going on. So taking a ball, in this case a peanut, is a great way to find that tissue and then encourage that to free up. So the way that I'd like you to do this is literally place the balls on the ground or the foam roller, whatever works best for you. And depending on where your tissue is, all I want you to do here is just go scouring through those quads on the inside, on the outside, towards that ITB as well, because again, that gets quite tight and tender in a lot of people. What I want you to do here is either just stay here and let the ball sink in to encourage the muscular tightness to release. But if we want to force this a little bit more, what we can do is we can tense the muscles over the top for a couple of seconds and then relax. You should feel like the ball sinks in a little bit deeper. But on top of that, what we can actually do is we can pin down a spot that feels a little bit restricted, like it does here for me. Then we can keep the tension or the pressure on the ball and then encourage movement to shear that tissue free. It's sort of like a tissue flossing exercise, but it's a fantastic way to encourage those sliding surfaces to move a bit better, to encourage some neural tension to go away, to encourage some of that musculature to relax and to give. Once you feel that, move up to the next spot, rotate around a little bit more, go looking for the spots that you find are important, have some pressure on that, keep the pressure on, and then floss that tissue through the ball to really try and encourage that soft tissue to normalize as well. So again, I want to double down and say that please do not do that on the injured area initially. There will come a point where it may feel comfortable for you to do that. It is your responsibility to make sure that you do not exacerbate this going forwards. But if you're past the acute stage, and that's well back in the past, and you're now looking to try and fix this to make sure that it doesn't come back again, then you've got to make sure that you feed a lot more slack into your leg from your back, from the front of your hip, to the muscles of your thigh and all the soft tissue around that. Now, the other thing that's really important to talk about is whenever we're trying to rehabilitate something, or at least short circuit some dysfunctional patterns, we still need to make sure that we're strengthening the area as well. So core strength is obviously really important in terms of planks and anything you can think of in that space. Gluteal strength is really important to make sure that we're supporting normal hip function, but then also quadriceps strength is important because obviously if you've injured your tissue, it goes through some atrophy, some decrease in strength that we need to regain before we can get back to our activities and be comfortable that things aren't going to come back again. And I find one of the best ways to do that, I'm a huge fan of just the basic squat, but in this instance, we're going to use a booty band around our legs to make sure that we not only get some quadriceps strengthening, but we can also force the glutes to work in a really nice functional way. And what we're basically looking for is, in an ideal world, I would always ask someone to have their feet pointing straight. Now, if you can only squat with your feet straight because that's the only way that you can successfully squat and feel comfortable, and you can't actually squat with your feet straight, then you are missing something important. Either your ankles are stiff, your hips are stiff, something's going on there that isn't allowing you to express normal squatting mechanics. Now, what I want you to do before you squat is with those feet straight, if we screw those knees out, essentially trying to put some tension through the band, you'll see that the arches of your feet will lift up and the muscles in your bottom will engage to create a really strong, stable ankle joint and a really stable hip joint from which your knees can just hinge backwards and forwards without too much issue. Having the band on will obviously encourage you to not let those knees cave in, but by externally rotating first, what you'll find is those glutes will engage, want to maintain that tension so that when you squat down, you will see that your feet and your hips and your legs will all translate in a linear plane. So if I can turn myself on the side here, hopefully you'll see this, my knees are going to be in this plane hopefully the whole time. Even though when you look at me standing forwards, my feet are straight, but my knees almost look like they're outside of my feet. That is exactly what we're looking for. The point being is that when we get down there, that those knees don't wobble, particularly when we get to the bottom and come up again, we don't want the knee to track inwards. So by screwing those knees out with our feet straight and then practicing this squatting motion up and down, in a very short amount of time, you should feel like those quadricep muscles get a little bit fatigued, particularly the VMO muscle, but we're also going to get a lot more attention through the glutes of those hips to again help support normal function of the lower half of your body. The important thing to touch on in this video is that if your ultimate goal is to stop your quadriceps tear from returning, you have to take a step back to understand that it wasn't bad luck that caused your quadriceps to tear. It's very likely that there is a bunch of hidden mechanical issues that you had no idea that were there beforehand. And if we're not taking a look at your lower back and trying to restore some normal function from your lower back in the segments that connect, control, and govern the function of your quads, then we're potentially missing the bigger picture. If you've hurt yourself doing something that you've done before, whether it's running, kicking, jumping, something that the body is designed to do, that should be a very strong signal that there's something going on behind the scenes that you had no idea was there, but that you need to redress that if you want to make sure that this never comes back again going forward. So I genuinely hope that was helpful. Let me know down in the comments below how you found those exercises. With that being said, I hope that was good, and I'll see you in the next one.